Hi there, Jamie. Hi, Dr. Steve. How are you?
Hello, Raj. How are you? I'm doing very well.
I'm doing
Yeah,
great. Thank you so much.
good.
Wonderful. Well, let's get started. I think we're ready to begin. And Jamie, if you want to lead us off.
Yes, Doc. So, I'll just play again the one that I played earlier. Again, welcome everyone, and I hope you guys have a wonderful day for this session. Okay, let's start.
Hello and welcome to Sleep Village. Thank you so much for joining us today for this special webinar. We are thrilled to have you all with us today. A special thanks to snoringandfatigue.com for sponsoring this event and making it happen. To join in, simply use your phone to scan the QR code you see on the screen. You can also share this link with your family and friends by clicking the plus sign at the top right of the page. Thank you for joining Sleep Village.
All right. Well, hello, everyone. Welcome to Sleep Village. I'm Dr. Raj Kakar, and we're so glad to have you with us today. If you're curious about how to breathe better, sleep better, and feel better, then you're in the right place. Today, we have a fantastic guest with us, Dr. Stephen Carstensen, a leading voice in airway health and dentistry. He's here to share some incredible insights on how something as simple as nose breathing and techniques like a mandibular advancement can make a huge difference in our airway health and sleep quality. This should be very interesting. We also want to give a big thank you to our sponsor, snoringandfatigue.com, for sponsoring today's presentation. Snoringandfatigue.com offers virtual appointments in the US and Canada. At snoringandfatigue.com, find the help you need with snoring and fatigue and start sleeping better tonight. All right, so let's get started. Today we're going to explore the power of nose breathing and how it can actually improve your sleep. Something so simple yet often overlooked. Dr. Carstensen will walk us through how nose breathing impacts our bodies and how it relates to mouth breathing. Dr. Carstensen has some fascinating information to share with us today, and we're excited to learn more. All right, well, throughout the presentation, please share any questions for Dr. Carstensen in the chat. We will try to address many of these questions during our Q&A at the end. This is a great opportunity to get expert answers to your questions related to nose breathing and sleep. All right, now let's welcome our special guest, Dr. Stephen Carstensen. Dr. Carstensen is a highly respected expert in dental sleep medicine with over 25 years of experience treating sleep apnea and snoring in Bellevue, Washington. As a consultant to the American Dental Association on sleep-related breathing disorders, he also leads the ADA's Children's Airway Initiative, focusing on improving airway health from a young age. Dr. Carstensen trained at UCLA's mini residency in dental sleep medicine and is a diplomat of the American Board of Dental Sleep Medicine. He regularly lectures internationally and directs sleep education at Airway Technologies and the Pankey Institute. He's also the co-founder and chief dental editor of Dental Sleep Practice magazine, and his 2019 book, A Clinician's Handbook for Dental Sleep Medicine, is a foundational resource in the field. In recognition of his impactful contributions, Dr. Carstensen was awarded the 2023 Distinguished Service Award by the American Academy of Dental Sleep Medicine. We're honored to have him here with us today to share his expertise on airway health, and welcome, Dr. Carstensen.
Well, thank you so much for the invitation. I love it that you're out there trying to spread the word that, something as simple as holding your jaw forward can improve airway. What I've always said is, look, it doesn't really matter how the airway gets open. It just matters that the airway gets open. So if we do that, and dentistry has a powerful role to play in being part of that solution. And the more people hear about it, the more questions will be asked of the healthcare providers in their communities, and the more people will breathe better every night. And that's where our goal is. And so I'm happy to share. So let me share my screen here, and we'll see what I have to say.
Wonderful.
There it is. There we go. So we're going to talk about two things that kind of are related, because if you're going to help somebody breathe better at nighttime and you're a dentist, then you're going to be using a mandibular advancement device. If you are anybody in healthcare, then you can promote nasal breathing. And I'll tell you a little bit more about why those two things work together as we go forward here. The key is that 9 in 10 kids out there display at least one symptom of a breathing problem. This is a survey that was done a number of years ago of parents asking, okay, does your child do any of these things? And nearly every child has at least something going on. So we should pay attention closely to our kids. The AAS, American Academy of Sleep Medicine, a few years ago estimated that 29 million Americans have some form of obstructive sleep apnea. And it's a spectrum of disease. And so it goes everywhere from mild snoring to terrible breathing at nighttime. And its number is probably insufficient, but if it's 29 million Americans, okay. If it's 19 or 39, there's still a lot of people out there that aren't breathing very well at nighttime. So we got to do something about that. So as you heard, then 9 out of 10 kids have some kind of breathing problem, and tens of millions of Americans at least have some kind of breathing problem at nighttime. And there's only about 7,500 current board-certified sleep physicians, highly trained physicians who start with some kind of a specialty and then they get a subspecialty in sleep medicine. But there's a couple 100,000 dentists out there. Now, we can't do everything a board-certified sleep physician can do, but we can do a lot of things to help people breathe better at nighttime. And most importantly, we can do a lot of things to identify folks at risk who are not breathing well at nighttime. And if we can add to the medical community's ability to impact breathing, then we are contributing to healthcare. We're contributing mightily to healthcare because what we do with helping folks breathe better at nighttime is impact their whole bodies. And that's really important to know and important to do, an important part of how we make sure that our communities are getting healthier and healthier. In fact, it was so important that a few years ago in 2017, the American Dental Association adopted a whole policy on the dentistry's role in treating obstructive sleep apnea. This was the first policy statement the American Dental Association ever did that related directly to a medical condition, in this case, obstructive sleep apnea. And so as we think about how OSA, obstructive sleep apnea, gets diagnosed, it's all in medicine. It was defined in medicine. It was treated by medical doctors. But early on, dentists were involved because the medical doctors needed more help than what they had back even 50 years ago. And so fast forward to 2017, the ADA, after a couple of years worth of work on getting this policy statement together, they came up with a statement that says, look, we have an important role to play. And we're encouraged to screen patients. And if you read the whole policy statement, it details all the roles that dentists have to play in especially adult sleep apnea, but critically in kids as well. So we are recognized by medicine to be part of the treatment. Our treatments are in the guidelines and protocols. So there's nothing about treating OSA that eliminates dentistry except diagnosis. We don't diagnose yet in this country, but we will soon, I think. And because of our role and the importance we can do, this is a responsibility now of our profession. Now, this is not a law. This is it's not in your state guidelines that you must do this. But honestly, when you are able to contribute to people's health and quality of life, and they come back and say, wow, I can't believe how much better I feel, it becomes such an improvement in your practice that it's really energizing to be part of this whole therapy. The role that we play as dentists is ideally to screen patients and understand who's at greater risk. And that's what screening programs do. And my favorite is called Stop Bang. We're not going to have time to go through all these details, but Stop Bang, you can Google this one, and that is a great screener tool. And a screener tool takes a population of people, let's call it your dental practice, and identifies who in that practice is at higher risk of having some kind of malady, in this case, OSA. So if you do a stop bank screener or an Epworth sleepiness scale, another popular one, and you discover people that, wow, I do have this problem, then your next role is to facilitate diagnosis. That can be online, it can be next door, it can be down the street, it can be in your community or online these days. Very simple to get a diagnosis through your practice. So people at risk, you direct them into a diagnosis, and then once they get diagnosed and you have a definition of what their problem is, then the diagnosing physician can make a prescription for what you can do, for how you can apply your mandibular advancement device in most cases to these patients. That's a role that only dentists can play. But in the meantime, we can help them with their breathing, because shockingly, a lot of people, don't pay much attention to how they breathe, and that's pretty natural. Breathing we don't think much about as long as we can do it, and when we can't do it, we consider that to be like an interruption, like some kind of a whole breath situation, or maybe we get real nasally congested and we struggle with mouth breathing. But on a regular day-to-day, night-to-night basis, there are ways to improve breathing that make us feel better. And we have that role to play because we have time and we have interested healthcare professionals, dental assistants, dental hygienists, that can notice how people breathe and make suggestions and coaching and training for how they can be better breathers, especially better nose breathers as we go forward. And I'll tell you about that. And then the most important role that dentistry has to play is that we are the only part of medicine that can pay attention to and assess and intervene for craniofacial growth and development. Sure, some kids have syndromes like Pierre Rodin syndrome or Willis syndrome, and those are troublesome genetic congenital problems. That's not what we're talking about. We're talking about normal, everyday, traditionally developing children who are developing a poor bone shape for their airway. So their maxilla is too far back, and the maxilla is too narrow. Their tongue is tied. Their swallowing patterns are incorrect. And so the bone shape is being influenced during growth to be too small. Those are the people that end up in my practice when they're 45 and 55 and they have cardiovascular disease because they've never breathed well through their whole lifetime. But if we can identify them when they're kids, then we get a chance to shape that bone as it grows, and we produce a properly functioning airway with a right shape and size. And then, by the way, the side benefit of that one is there's plenty of room in that bone to support all the teeth, and we don't have to take out teeth, and tooth alignment becomes better and bites become easier to establish. But critically for their health is not how their teeth are aligned. Critically for their health, it's how they can breathe through that bony supported airway. And that's our role. That's going to be our major role to healthcare that we've ever had a chance to do in dentistry, is to help people breathe for their lifetime. So that's our role in a nutshell as we go forward. Because dentists are trained in all body systems. Dental hygienists are trained in most of these. And training means we're not experts at the cardiovascular system. We don't get to assess how the GI tract works. But we have interactions with every one of these body systems through our training. And all we have to do as dentists is to pay attention to the interactions of those systems as we see them in the oral cavity. The growing trend of paying attention to the oral systemic balance and what we can take from our observations in the oral cavity in terms of assessment of how the rest of the body must be doing, the microbiome, how our periodontal disease management interacts with their overall health and cardiovascular health, what we can notice from the tone and shape of the tissues that might indicate that they're having troubles with insulin resistance. Those kind of things are all there for us to see. And when we narrow it down to the teeth, yeah, sure, that's a cavity situation. It pretty much stays in the oral cavity until it gets out of the oral cavity with a big infection. We all understand that risk. But there's so much more that dentists are being able to notice about whole body health this way. Now, we're not going to be diagnosing GI problems or cardiovascular issues, but we certainly can play a part in healthcare as we go forward with that. And as we learn about sleep and breathing, we inevitably must pay attention to the effect on the whole body physiology and on homeostasis. It's just it's what we do. Breathing is a mechanical thing that supports respiration, obviously, but when we consider the implications of disturbances to that respiration, it's easy for us to learn, wow, there is really something to go with atrial fibrillation and when breathing is interrupted. And we talk to our patients about healthcare and health issues. We can become better doctors for them by helping them understand those implications for their own health. And then when we help facilitate a diagnosis and a treatment that allows them to feel better, having fewer AFib episodes, for example, or waking up with more energy, then we're heroes because we help them see a pathway that maybe nobody else had helped them with before. And that's really powerful and important. In fact, this little graphic here, which everybody's welcome to have, I can happily share it with anybody. And you're not intended to read this graphic, the words are too small, but I can tell you that every word in every one of those white boxes is a disruption to homeostasis. It's a challenge to the body health, and it's nothing that you want. You don't want anything that goes on in those white boxes there. I pulled out a few of them just as highlights, but there are many others in there that are important. And any one of those might be critically important to the patient that you're talking to. And since obstructive sleep apnea influences every one of those issues across the whole body, when you're helping your patient get diagnosed with OSA, when you're helping your patient manage obstructive sleep apnea, or possibly even embark upon a pathway for addressing the root cause and possibly curing obstructive sleep apnea, then you are affecting the whole body every single time. That means you must know a little bit more about the physiology of the whole body as you go forward, which I have always found to be professionally interesting and challenging, and makes my job as a dentist much more interesting. I'll keep coming back to that word, but it's fascinating how what we do intersects with all of these other things. So are you going to become a cardiologist? Of course not. You're going to become a dentist who pays attention to how what you do affects your patient's heart health. And that's a powerful place to be in healthcare. So this little video is pretty handy. Please make sure guys.
Over 30 million Americans suffer from breathing-related sleep disorders. While you sleep, most of the muscles of the body are relaxed. Sleeping on your back allows the base of the tongue and the palate to drop back and block the airway. When the airway is partially blocked, the flowing air can cause the muscles to vibrate, resulting in snoring. When the airway is completely blocked and no air can get through, it is called obstructive sleep apnea. This condition is very serious because it causes your body to be starved of air, causing unhealthy blood oxygen levels. Snoring and sleep apnea interrupt sleep, causing your brain to be aroused. Poor sleep like this will often lead to irritability, daytime sleepiness, and less ability to concentrate on tasks such as driving. If left untreated, sleep apnea can lead to high blood pressure, heart attack, stroke, and diabetes. Often, sleep apnea is treated with an air pressure mask called CPAP, which helps you breathe by pushing air through the nose and holding the airway behind the tongue open. While CPAP treatment is effective, many people find this therapy bulky, complicated, and uncomfortable. An alternate, simpler solution is a mandibular advancement device, or MAD. A MAD is a custom device made from impressions of your teeth and bite of your jaw. The MAD is worn in the mouth while you sleep and promotes breathing by moving the lower jaw forward, allowing the tongue and other soft parts to be pulled forward, preventing them from blocking the airway. Initially, you may experience some minor tenderness in your jaw or teeth, but these issues are typically a temporary reaction and will usually correct themselves as you get used to wearing the device. Healthy sleep is very important to your overall physical well-being. There are several different types of MAD, so talk with your dentist about all your options on how you can get the best night's sleep.
So little videos like that, I wrote that one years ago for this company, Guru, because what we need is to be able to communicate to our patients what's going on. So little videos like that, which you're welcome to as well, can be used to put on your website, put on your panel at your that your patients might be watching while they're waiting for you, in your reception area. Lots of ways to make sure your patients understand that there's a serious problem and there's ways that can be addressed.
Okay.
All right. So when we're thinking about what we're going to do with the lower jaw, we have to consider that what we're going to do is bring the lower jaw down and forward to open the airway. We think about the 3D anatomy back there, like the video said, and we are going to bring the mandible forward because it is the movable part of the upper airway. If we consider all those parts back there, the palate, the pharyngeal walls, the base of the tongue, the mandible being able to come forward allows us to impact the closure of that flexible space, the upper airway, the oral pharynx. It's a little bit more complicated than that, but that's enough for us to see today. And so when we bring the jaw forward, because of the shape of the glenoid fossa and where the condyle is, we also have to bring it down a little bit, which impacts the length of the resting length of those muscles and the soft tissues, which means that our patients are going to have a little response to this. Now, I'm happy to say that typically with the dimensions of the change that we ask our patients to do with our mandibular advancement devices, the amount of change, the amount of discomfort, the amount of awareness of these parts is very low. So I make lots of the appliances. That's what I do in my practice, and nearly nobody comes back saying, wow, it's so uncomfortable that I can't wear it. That many of them say, it's a little different. It's kind of like starting a new exercise or something where my body's telling me I'm doing something different, but it's not a problem. And then after a few days, that's even gone. So we don't have much of a trouble with getting people into mandibular advancement devices and bringing their jaw forward to take advantage of the impact on that upper airway, that oral pharynx collapse that causes sleep breathing problems. So when we do that, though, we do have to be aware of this anatomy. And so when you consider adding this to your dental practice, it's also important for you to refresh your understanding of how these parts work. The jaw joint works. What are the parts and what are the implications of that? What is the 3D anatomy of the back of the mouth and the oral pharynx, the palate, the adenoids, the hypopharynx? These are all terms we learned in dental school or dental hygiene school, but oftentimes we overlook them in everyday dental practice. Well, getting into doing sleep medicine practices helps you see the importance of refreshing your memory on these things, which is kind of fun. And it is just a refresher because you got it before and you can learn more about these things. And it's an interesting challenge. When your patients come back and say, yeah, I'm noticing this, well, then you'll be confident in the answers that you have for them to make sure that they don't get over worried about minor symptoms. And that's really important. Now, a longer talk could walk us through many of the different designs that we have, and there's over 150 different oral appliances that can be fabricated to hold the mandible forward and down to keep the upper airway open. Now, there's about 5 or 6 different designs of these, but there's lots of iterations through different manufacturers for how this works. In general, because they all do the same thing, they just do it in different ways using different materials. So we have nylon materials like the ones on the far right of your screen there, and those white nylon materials, I think that's the growing trend. I think that's where we're going to be going in the future. Most of those are 3D printed. Some of them are printed in fancy ways using lasers, but what we can see with the nylon is it holds up really well. It's very acceptable to patients, and it's quite thin and small in the mouth. And those are all considerations that make the usefulness of these devices much more common. But there are simple ones, like on the far left of the screen, and with that yellow band on it, that's a simpler device. It's made with a simpler base and it's less expensive that way, and allows us to set our fees to be more reasonable and help people get more treatment because it's not as expensive. So there's a whole range in between there of different designs, different materials, different manufacturers that the dentist who's interested in helping people breathe better can use for any individual patient. And then all of them have an indication that makes them a better choice. Some of them are smaller, some of them are more bulky, some of them have an attachment that brings the lower jaw forward and absolutely doesn't let it go backwards, and some of them have attachments that kind of keep the mouth closed, and some of them allow free movement of the mandible. All of those features are give the dentist who's trained on these an ability to match the right device to that patient's concerns, that patient's wishes, that patient's individual test results. And so the more precise we can be with our medical treatments, the more likely we're going to be successful, and the more likely the patient's going to actually do what we ask them to do, which is to wear these devices all night, every night. So you can't master one device and say, okay, that's the one I'm going to use for everything. There is no such thing as a universal oral appliance to hold the mandible forward. There are plenty that work for lots of people. And there's a few that work for only a narrow number of people, but the dentist who's applying these to their patient populations needs to be able to use one of several devices. You don't have to master 150 of them, but you have to have 3 or 4 different designs in your head and in your hands to where you can match those up with a particular patient. And so that makes it necessary for dentists to be involved here. There are some physicians who make oral appliances. Some ENT doctors think that they have the expertise required for this. And in my town, we had a couple of ENTs who were making some of these appliances, or even a couple of sleep physicians who were making some appliances. And I said, more power to you. You go ahead. Because what happens is the patients come back and they say, my jaw hurts. Well, these physicians don't know anything about jaws. They don't know anything about teeth or jaw joints or anything. And so when the patient comes back and says, jaw hurts, the physician doesn't want to be in a position. And so they pass that off, and that decreases their enthusiasm for doing more oral appliances. So the patients aren't hurt badly. Don't worry about them. They'll be fine. And oftentimes they come to my office in my town and they say, well, my physician made this and I had these troubles, and so they sent me here, and I'm happy to do that for them. So when you hear about that, don't get concerned. Just become the dentist that they want to send people to. So one of the critical things that we always have to think about is why are we having people breathe through their nose? Years ago, a foundational paper was written by Dr. Christian Guilleminault, and Dr. Guilleminault is the physician who defined apnea-hypopnea index, defined obstructive sleep apnea about 50 years ago. And so he was the key physician for this whole field. There were some others around him, but he was the guy. Well, he and Dr. Sullivan, who's still practicing down at Stanford, wrote this paper, and one of the most important phrases that's ever been published is that they said nasal breathing all the time is the only valid finish line for proper health. And the paper supported that with good science. But what we think about what happens here is that too many people are mouth breathers. And when they're breathing through their mouth, they're not supporting their physiology in ways that it should. We consider what happens in the nose, and if you think simply about the nose as something, as another route of breathing, you minimize the contribution the nasal mucosa gives to the whole body physiology. A few years ago, I did a lecture up in Fairbanks, Alaska in January. So it's minus 10 degrees, and that was kind of fun to be up there in minus 10 degrees, and I was having a good time, and I went out with a little hike with my friend Lee, and it was, I don't know, minus 7 or 8 degrees while I was out there. But I was realizing that by the time that super dry, very cold air reached my palate, so just a few centimeters past my nares, then that air that I was breathing in was 100% humidified, body temperature and filtered. So that's the magic of the nose. And there's much more that goes on there. The more I've become a nose scholar, the more I'm impressed with how powerful this part of our anatomy is and the contribution it brings to our homeostasis, our ability to manage our day-to-day physiologic challenges. If we don't breathe through our nose, then humidification doesn't happen, heating doesn't happen, and filtering doesn't happen. So I could have opened my mouth in Fairbanks and breathed in 0 degree or minus 10 degree air, and my lungs would have had cold air, it would have had dry air and dirty air into my lungs. That's not what you want people to have in their lungs. You don't want it in your lungs. You want warm, moist, and clean air in your lungs. There's other things that go along with that too. So what can you do as a dentist? Well, you can recognize mouth breathing. It's simple if you're talking to somebody and you can watch their lips being open and breathing through their mouth. You can also observe them while they're sleeping, because that's actually the more damaging portion of mouth breathing for lots of reasons. We can see it when we notice in our oral cavities some consequences of mouth breathing. So if you notice that there's a maxilla that's extra narrow, it looks like it's been pinched in from the side and the palate is highly vaulted, what that is a consequence of is mouth breathing during growth. So during single-digit age years, that maxilla having the mandible opens for mouth breathing, the maxilla was misshapen by the buccal mucosa, by the function of the buccinator muscles and the closing muscles, the masseters, and that maxilla was pinched narrow. When the mandible hangs open for mouth breathing, other changes happen. We get a high angle of the mandibular plane angle. We get mucosa that ends up getting dried out in front. So if you've had these patients with red outlines of their maxillary anterior teeth, that's 100% from mouth breathing. And so we can recognize these things in our patients when they come through our clinics and ask them about history. We can ask them about current events. If their gums are always tender on those front teeth, then wonder why they're mouth breathing. Could be a habit, but they also could be allergic to their environment. They could have nose blockages. They could have high nasal resistance, lots of things like that to develop. So that's how you recognize some of the signs. And you can ask people. So you watch them breathe, you look in their mouth and see what these problems are, and you ask them what they're like when they're sleeping. If they wake up with dry mouth every morning, if they have dry mouth symptoms, they have to keep water by their bed because their mouth gets so dry, then what they're doing is they're mouth breathing, and we got to change that. We got to help them change that with different ways that they can do those things. So the most damaging time of mouth breathing is during growth years, but the damage continues through all adult years. So what's a simple nose breathing test? Really easy. All you have to do is have people close their lips together and see if they can breathe comfortably for 2 minutes, or some experts say 3 minutes. And what that means is you have to have them make sure their mouth stays closed. And the simplest way to do that is to have them close, just explain this to them, and they close their lips together and breathe through their nose, and have them take their finger and just put it over their lips and hold it there for 2 minutes. And the reason why you want them to do that is because if they're a habitual mouth breather, they will cheat. They will tell you that they're holding their lips together, but in fact, they'll part just a little bit because that's what they're used to doing. Putting their finger over their lips for 2 minutes reminds them that they're doing something different. And the question that you have for them is that, how did that feel breathing through your nose for 2 minutes? Did you feel like you needed to breathe faster? Did you feel like you needed to work harder at getting air to move through your nose to make sure that that worked out well? And if it did, that means you're not a very good nose breather. We can improve that. We can help you be a better nose breather. And so it's not like, now obviously if they just can't do it, I mean, they put their lips together and they just try and breathe, and no, that they have to stop before 2 minutes is up. Well, clearly there's improvements to be had. Yeah, but if they also notice that they had a little bit of anxiety about that, that's also a sign. So how can you help them with this? Well, I am not connected with any of these products, and so I'm telling you these products only because these work for me. There are other products that you can use. Please don't see this as anything more than just these work for me. Clear Spray and NeilMed are two excellent companies. NeilMed, by the way, if you're a dentist, still will send you samples. But get the xylitol-based samples. And why? The xylitol changes the microbiome in the nose to make the mucus less sticky. So it makes it easier for them to be a nose breather if they use xylitol in there. You can have them hold their lips together with lip tape. And there's a number of different varieties of lip tape, including just 3M's simple paper tape. And all that does is it's like their finger over their lips. It just makes them a nose breather. And we know from research and science that the more they breathe through the nose, the better they breathe through their nose. And so if they have neglected nose breathing as a habitual mouth breather, then their nose doesn't function as well as it used to. So as they transition back into being a better nose breather, the work that they do means that they must keep their lips together so that they can overcome that habit. And that's what lip tape does, is it keeps the lips from habitually falling open so that their nose becomes the sole route of breathing for a little while, and that makes them easier nose breathers. You can also use some supports. One of those is Max Air nose cones. There's a lot of nose supports on the market. Flonase is a good medicine that they can use. I'm not a big fan of it because they have to use a lot of it. But lots of people know Flonase, and so they trust it, and that's not bad. And then a new product on the market is called Somnoseal, and this was developed by a friend of mine down in Portland who's a sleep physician, and she wanted to see what could she do to help her CPAP patients not have air coming out their mouth while their CPAPs are functioning. As she showed it to me, and I said, Kim, that's fantastic. Why don't we should market this to everybody because we can help people keep their mouths sealed up by this little silicone cover that goes under the lips and makes them into nose breathers. And so I love this functionality of this particular product because it makes people better nose breathers and it doesn't look like tape on the outside. So it's good for people with beards, as a matter of fact. And other people just don't want tape on their lips. And so that's pretty handy that way too. So Dr. Barry Raphael, who's a fantastic orthodontist over in New Jersey, he trains people how to breathe better. And he says, first make it easy for them to breathe. So he expands their jaws if they need to. He helps them orthodontically. And then we have to teach them how to breathe easily. And so that's the coaching that we can do. And there's resources for that you can use. Because most importantly, we have to think about the nose is for breathing and the mouth is for everything else. And why is the nose so important for breathing? Because as we bring the jaw forward, we open the oral pharynx. When we open the oral pharynx, we reduce resistance to breathing through the nose. And when we reduce resistance of breathing through the nose in any way that we need to, then we also make the oral pharynx less likely to collapse. So everything works together when we bring the lower jaw forward and we improve nasal breathing. It's all part of the same system. It can't really be separated. And as we are doing our dental thing by making mandibular advancement devices, we also need to do our dental thing by helping noses function better. And in fact, if you look at the American Dental Association's definition of dentistry, it includes all the things you would expect, like oral cavity things, teeth, gums, jaw joints, but it also says the effect on adjacent and associated structures and their effect on the rest of the human body. That was intentionally put in there when this was defined many years ago. And nose breathing is an adjacent structure. Its effect on the rest of the human body is up to us. Now, we're not going to become ear, nose, and throat doctors. We're not going to do surgeries in the nose, but we certainly can coach people on how to be better nose breathers and provide them with non-invasive therapies and practices that can be used for that. And one of the most fascinating things I've found in my study of noses is that there are actually mechanoreceptors inside the nose. And what that means is there are specialized cilia cells. Now, we remember from our anatomy training that there are cilia in the mucosa of the nose that sweep the mucus into our throats. That's why we have drainage. That's why we swallow, because we have mucosa from our nose and sinuses that sweep the filtered, dirty air. The parts that have been filtered out sweep backwards, and our noses don't run that way. Well, some of those cilia are specialized mechanoreceptors, and what they do is they send electrical signals to the middles of our brain called the limbic system. And the limbic system is a bunch of different parts, and the limbic system does a lot of things in our brain. But here's some summary of what some of the parts of the limbic system do. Notice that some of that is learning and memory. Some of that is emotions. Some of that is control of the autonomic nervous system. So when the limbic system is disrupted, then these key parts of our homeostasis are disrupted as well. And that means that we need to protect what signals the limbic system are getting. And it turns out that when we breathe through our noses, nasal breathing elicits a steady electrical signal to the limbic system. This has been proven over and over again now. And when we lose nasal airflow, that limbic system signal is also lost. Now, we don't know the full implications of that, because that's a difficult place to go with a complicated part of our brain called the limbic system. But what we do surmise in physiology is that there's a reason for that nasal airflow causing an electrical signal to the limbic system. And if we willingly give up that electrical signal, we are not providing the limbic system with a time stamp. And what the scientists describe this is that we get a disorganization of limbic oscillatory synchrony. What that means is it's not given a metronome-like timestamp. Because you think about respiration, in and out, in and out, in and out, 6 times a minute, 12 times a minute. And so the limbic system is getting that electrical signal that frequently, that steadily. If we disrupt that steady signal, then the downstream consequences of that, well, they can't be good. They might be neutral, but they can't be good. So we might as well cooperate with how our brains are put together. We might as well support the signal for homeostasis and help people breathe through their nose. And most physicians pay attention to the nose when it's plugged up, when there's a symptom. We can pay attention to the nose because we understand the trigeminal nerve very well. That's our area. And we can help these signals from the nose because we're there observing it very frequently. So the trigeminal nerve, again, so it's dentistry's nerve. It's the head and neck nerve, and we do a lot of things. We understand the trigeminal nerve from our anatomy training and what we do with it and how we make it numb and how we deal with the pain that's involved. But there's a lot of things that go along with the trigeminal nerve, including helping balance the autonomic nervous system, making sure that we're in parasympathetic mode as much as we can. And it does a ton of other things from the nasal mucosa. So the more we study this, the more we can be impressed by the impact the trigeminal nerve has on overall health. And again, that's our area. That's where we need to be experts at. One of the things that's true is that if we can slow down our rate of breathing, we can impact how we feel. Now, we've known this for thousands of years. Yogis and breathing coaches have shown that nasal breathing and slow nasal breathing can impact our physiology. That's how we calm ourselves down. And in Eastern medicine practice for, again, thousands of years, they've affected human physiology by simply breath work. Well, what you can do today is, without becoming an Eastern medicine expert, is you can just help people recognize that if they're feeling anxious, if they're feeling like they're out of, they're not feeling well, if they can slow their breath down and make it different, then they're going to have a serious impact on their physiology. So this study was published in 2018, and in fancy words, it says a nostril-based respiration, breathing through your nose, stimulating that epithelial cilia cells, one of the pivotal neurophysiologic mechanism allowing slow breathing techniques, psychophysiologic effects. And they're all positive. You can see that in the arrows there. Every one of those slow breathing effects are positive for health. So how do you learn more about these things? Well, the upper right slide picture there is called The Breathing Cure. Patrick McCowan is I call him our global breathing coach. And he has a number of books, I think 10 or 12 books by now. He's also got a YouTube channel and a website. They're all called Oxygen Advantage. And I told him, I said, I don't like the word cure there, but that Breathing Cure book is an excellent resource for you as a healthcare provider. It helps you understand some very simple exercises people can put themselves through to help them feel better all the time and overcome some of the issues that have to do with interruptions to homeostasis, including in your practice, including in their everyday lives. So even though you're not going to cure things with breathing, like Patrick wrote in his chapter, in his title there, you're going to really help people with lots of things. And so I encourage you to get that one. If you don't want to get the big, thick Breathing Cure book, get the much thinner but very helpful book called Oxygen Advantage, or go to the website Oxygen Advantage or the YouTube channel of the same name. I'm just a big fan of what we can do with nasal breathing. I think everybody that breathes should read James Nestor's book, Breath. If you haven't read that yet, you owe it to yourself to pick that one up. James is a medical journalist, put himself through some tests he calls heinous so that he can write good stories about that. And so and that's a global phenomenon that's printed all over the world nowadays. And so that's doing very well. And I like all of the resources you see in front of you here. These are all very helpful resources for you to go forward with. And don't forget that only a trained dentist can help children grow their airway. Nobody else is helping grow the orofacial complex to get the maximum bone support of the airway during growth years. Nobody else does that except us. Only a dentist can evaluate the mouth and fit a custom device that doesn't cause trouble with the teeth, jaw joints, or muscles any more than a patient can normally handle. Only a dentist can deal with the complications because it's our expert area for how all these parts work together. And we need to collaborate with our diagnosing physicians at this point for combinations. And so, in other words, if they're going to use a CPAP and an oral appliance, if they're going to use some other thing, nose breathing plus an oral appliance, that's our role to play. So that's my message for you guys today. I'm just about out of time, guys. I do have a trailer for the Out of Breath movie, but I'm not sure we have time for that. So you tell me.
All right. Well, thank you very much, Dr. Steve. Looks like we do have time for a few questions, and wanted to give an opportunity for that, as well as maybe if there's a time for the trailer, we'll see. I guess let's start with a couple of questions that have come through. One of our viewers is asking, how do I know if a mandibular advancement device is right for me, and where can I get one?
Yeah. So what you can think about with that one is if you've been diagnosed with a sleep-related breathing disorder, and there's the two effective non-invasive things you can use are CPAPs and oral appliances. Now, unfortunately, there's not a great test for whether a mandibular advancement device will actually work for you. You know, I hate to lay it out there like that, but one pathway that a lot of people have used is they get an anti-snoring device from, online or somewhere, and they try that out. It's over the counter. And if you feel better with that, then what you can understand is a custom one will feel more comfortable on your teeth. It'll be easier for you to manage, and it'll be more effective. But that over-the-counter trial, which won't cost very much money, will be able to give you a glimpse into whether that might work for you. Now, be careful if it doesn't work, that you're not ruling it out because of comfort and fit. Because understand, a trained dentist will make something that fits you perfectly. And all the custom ones are more effective than any of the over-the-counter ones. But if the over-the-counter one gets you closer, well, that gives you an idea that it might work for you. But we don't have a great way to predict whether the oral appliance will be correct for you. But understand, with a diagnosis of breathing problems, then there's only two non-invasive things you can do: CPAPs and oral appliances. And more people can accept oral appliances by far than will accept CPAPs.
We have another question here for somebody who's asking about the oral appliances, that they're concerned about the cost. Are they affordable, and do they need a prescription?
They are a medical device, and so you do need a diagnosis and a prescription from a physician. They are covered. There's a benefit anyway by nearly every medical insurance that we work with. They're not covered by dental insurances. They're covered by medical insurances. And so there's always that complication. But that's all I work with. That's all I've worked with for this part for 26 years. And it's all we do now every day. So yeah, they range from where you get them, how much they cost, but there is a benefit available if you go through the right steps, like many other things in medicine these days.
And one more here from Max is asking that for people like him with chronic sinus issues, are there any risks or contraindications for using an oral appliance?
None at all, because if you have chronic sinus issues, first of all, obviously you need to address those. But all of the appliances do allow mouth breathing. So you're not locked into only nose breathing with a mandibular advancement device. It does make your mouth breathing easier if you get the right one, because you have a space to breathe through, and it's small, so it doesn't take up much room. All those things are considerations the trained dentist can take advantage. And actually, I mentioned in there that the trained dentist needs to have more than one design to work with, and that's why, is because we take all of those parts into consideration. And interestingly, when you're sleeping better, and there are techniques for getting your chronic congestion fixed up, and then you actually become a better nose breather and can maybe get rid of some of that congestion. One quick one is, if you have chronic congestion, then I think you should have a HEPA filter in your bedroom, because the nose physiology changes while we sleep. It changes while we're on our backs while we sleep. And so if you have dirty air in your bedroom, for whatever reason that might be, then your nose is going to respond to that. So make sure you have clean air in your bedroom.
Yeah, that's great. I think that's great. One other question that I have sometimes asked for me is some patients ask, well, are there any exercises they can do? Obviously, you discussed it today about nasal breathing and nose breathing exercises, but sometimes they ask about exercises to try to improve their nasal breathing, or also to try to help to reduce snoring. What's been your experience with that?
Oh, this is great. Again, my friend Patrick McCowan, oxygenadvantage.com, or the YouTubes, the website and the YouTubes are all free. Go there. They're powerful, super easy exercises to do. And amazing how much difference you can make in your nose breathing just by how you do it, or a few minutes a day of very benign type of exercises. These aren't onerous. It's not like, it's just super easy and surprisingly effective. So quite happy with that. Some people ask about exercises for sleep apnea, throat exercises. Can I make my throat less likely to collapse for breathing problems? And technically that's true. There are, but you have to, the two science studies that we've seen show that you have to either take professional voice lessons and then practice singing 30 minutes a day, or you can play a didgeridoo and practice that for 30 minutes a day. Both of these are tough to keep up with. So we don't have a practical exercise yet for the oral pharynx, but we have lots of them for improving nasal breathing.
Wonderful. Well, that's great. Yeah, that's great.
And sleepapneafilm.com is the whole website for that. There it is, right there. You got it right there on the Max. Put it up there for you all. Yeah.
Okay, wonderful. Thank you very much, Max. Yeah, fantastic. So that you can catch that online at sleepapneafilm.com, and the documentary is called Out of Breath.
It sounds like slow strangulation, like somebody's just squeezing your neck until the lights go out.
You're right, but that's kind of dark. Oh, let me get the camera set up.
Sorry.
My name is Billy, and I have sleep apnea.
Well, wonderful. Well, again, we'd like to extend our thanks to snoringandfatigue.com for sponsoring today's webinar, and we want to wish everyone a joyful holiday season. And as we wrap up, I'd like to thank all of our viewers and listeners for joining us. Your participation is what truly makes Sleep Village community special. And thank you again to Dr. Steve Carstensen for sharing his expertise with us today. Very interesting information and very helpful. And we thank you again to snoringandfatigue.com for being our sponsor. We look forward to seeing you next time, and please stay tuned to Sleep Village for more for newer updates and more information and updates in sleep health coming in 2025. Thank you all very much.
Thank you, Dr. Kakar. I appreciate your efforts to get the word out to everybody. It's just really, we're all pulling together on that rope. It's good.
Yep, absolutely. Thank you. We very much appreciate your time and contribution.
Take care.
Bye-bye.
Thank you to everyone who joined us for today's webinar. We truly appreciate your time and participation. Remember, you can invite your family and friends to be part of Sleep Village by sharing the QR code on your screen. Feel free to take a photo of it or click the plus sign at the top right of the page to invite them directly. Once again, a huge thank you to snoringandfatigue.com for sponsoring today's event. If you would like to rewatch this webinar or check out the previous sessions, visit our YouTube channel at Sleep Village Official. Don't forget to subscribe so you will stay updated whenever we upload new videos.